COVID-19 has put us in a pretty tough spot. We all have to do the responsible thing, practice social distancing and self-isolation, all for the good of the whole. But what happens when you're at home and you get injured and you can't seek the help of your trusted healthcare provider? Well, in today's video, we will cover some at-home self-help strategies you can use in just that type of situation. Hello everyone, Dr. Lejkowski here, and the purpose of today's video is to hopefully prevent some unnecessary medical care visits. While no two injuries are created equal, the most common injuries that occur around the house are non-traumatic, such as bending over and hurting your low back or waking up with severe neck pain, just as an example. With that being said, if there was trauma involved, such as a bad fall, especially if you're over the age of 65, you may need medical attention, so please use your best judgment. Some of the most common injuries that we see in clinics are low back pain and neck pain. Therefore, in today's video, I will specifically refer to those. However, please note that the tips offered in this video will apply to most common injuries. A new injury to the low back or the neck can leave you in severe pain and feeling very debilitated, but this does not mean that you're broken. In most cases, these injuries do not require medical attention or any imaging, such as x-rays or MRIs. There are effective strategies you can use at home to self-manage your way out of acute pain. Let's cover some of these. Even some of the most severe cases of back or neck pain do not require bed rest. While your pain may be telling you to lay down and stay down, bed rest is one of the worst things you could do for it. Laying down for prolonged periods of time will just leave you stiff and more sore over time. Once again, you may feel like you're broken, but you're not. So it's time to stop acting like you are. Which brings me to the next point. Get moving and stay moving, even if that activity is only for a few minutes at a time with frequent breaks. Even though you are injured, do your best to maintain daily activities as much as possible within your tolerance. The people who work hard to keep moving early in their injury are the ones that consistently get better quicker. You would be surprised how much better you feel just after a walk, even if it's just around your house. Once you find an activity that feels good, do it, and do it often. Heating up the area that hurts with a heat pack or while taking a shower will help you relax muscle spasm and at times provide you with instant relief. Use heat in between periods of activity to give you some relief before you get moving again. We do find that moist heat tends to work better. So if you're using a heat pack, heat it up and wrap a wet towel around it for an instant moist heat application. But keep in mind that it is not safe to do this with electric blankets. If you have a partner that can give you a gentle massage, they don't even have to be well trained to help. Sometimes just rubbing the skin over the injury can help alleviate some discomfort. Using a TENS machine such as this one can certainly help with pain. This is sort of like electrical aspirin. This machine electrically stimulates the skin, muscles, and nerves over the area of pain and provides some temporary relief. You can purchase one of these for under $60 online and can literally clip it to your belt and use it while you keep busy around your house. While most people feel compelled to stretch out the area when they're injured, we actually advise them not to. Look, without a proper assessment, you don't know where your pain is actually coming from. It could very well be coming from a pulled muscle or a sprained ligament, and in either case, you would not want to be stretching out these tissues. While in some cases stretching may give you some temporary relief, we find that in many cases it creates more tissue sensitivity over time. If you are feeling stiff, get up and move. Motion is lotion. So while you do not know the true nature of your injury, we actually advise you to avoid stretching. While many people turn to medications for the answer to their pain, the research suggests that medicated may not provide you with the relief that is any better than some of the other strategies already mentioned here. With that being said, there is a time and place for medication. So if you're in severe pain and it is safe for you to use over-the-counter medications and you find they help, definitely use them to help you relieve some pain so you can stay active in your life as much as possible. Research suggests that medications such as Tylenol are safer than non-steroidal anti-inflammatory medications like Advil or aspirin. So you may want to start there and see where it takes you. Get on the phone with your doctor or your local pharmacist to see what medications are right for you. So that brings us to the end of this video. I hope you enjoyed it, and I hope that the content helped you self-manage some of your pain. If you did find the content useful, please do share it with those who you feel will need it. I'm Dr. Peter Lejkowski. Stay healthy, everyone.